Hello, we're here today to talk more about our 40not50 program, and we're lucky to have a wonderful guest, Tanya, who has a story to tell that will really make you a believer on the importance of starting screening at an early age. So, Tanya, how did your story start?
Well, I had a baseline mammogram when I was 38, and that was back in the late 90s when it was recommended that you get a baseline between 35 and 40. And they saw benign calcifications that said they were benign and start getting annual mammograms at 40. So when I turned 40, I scheduled a mammogram, actually canceled it because I was working late and I knew I was running late to the appointment, and they said, oh, it'll take a couple months to get back in, and I said, no problem.
Right.
And I went and got the mammogram, and
Right.
I was diagnosed.
So the mammogram, I remember we reviewed that specifically. We got the old film, and that cancer was exactly where those calcifications were 2 years earlier.
Yep.
So what had we diagnosed it at age 38, it would probably be a simple lumpectomy, and that was it. But tell us what happened in your particular case.
Yeah, in my case, I'd been living with the cancer for a couple years at least, and so I ended up having to have a mastectomy, and I chose a bilateral, and then chemotherapy, and lost all my hair, and could have lost my life.
Yes, I mean, what you hear these mammograms now, women telling women to start at age 50. I mean, did you have any family history? Any reason that anybody nowadays would start you earlier? I mean, you didn't have any family history, as I remember it.
Yeah, there was no family history, and now I've learned 85% of the women who get breast cancer have no family history,
Right.
and frankly, I thought it was the opposite. I thought it was a disease of family history, and I never personalized the risk, and I think most women don't personalize the risk unless they have family history. So, yeah.
So thank goodness you got that mammogram at 38, and this was a golden opportunity to really make it easy. And had you taken care of it then, it would have been a pretty easy go for you. But as it was, you ended up, the chemotherapy is a pretty rough thing to go through. And yet, look at you, how many years survivor are you now?
I'm 15 years.
15 years out.
15 years surviving. I was diagnosed actually on my twin boy's 6th birthday. I found out I had cancer. And so that was 15 years ago, yeah.
So how did you tell the children? That's something that the patients often ask me, what do I tell the kids when I've been just diagnosed?
That was tough. You actually helped me with that, Dr. West. You had us meet with someone in your office, and they gave us a book, and they said, talk to your kids. These are young kids, twin boys, 6, and we have a daughter at the time was 7. And they said, you know, talk to them as if your body's a garden, and there's weeds growing in the garden. And so what do you do to get out to eliminate weeds? You take them out, you spray fertilizer on there to keep them from growing back, and so that's how we described the cancer and the treatment of chemo and surgery.
Did they just kind of let it go at that, or did they ask much in the way of other questions, or how did it work out?
I think it was, you know, I think this after the surgery, you know, you're in a lot of pain, and then the chemotherapy where they physically see the effect on you.
They'd see you bald, or did they?
Yes, bald and throwing up and getting sick and everything. So that, I think that was a very difficult time.
Yeah,
the reality set in.
And I think seeing your mom bald, and how was that experience in terms of, I remember we had this conversation years ago about all the stresses of being diagnosed and thinking of the treatment, the chemo, but you told me one thing that nobody else has said. You said there was a low point in your, do you remember that? Remember that?
I'm trying to, low point.
You were with your father and you were shopping for wigs.
Yes.
Tell us.
Yes, that was really hard because, well, my father is a hairstylist, so there's that connection. And I made him shave my head off because, or hair off, shave my hair because I felt like it was the only thing I could control at that point in the journey. And I was starting to lose my hair, and so I said, Dad, shave it off. And he said, okay, and he started to shave my head, and I just started crying. And I felt so bad for him. But then we went wig shopping, and there just was nothing available in those days, so I just chose to go bald. Yeah.
So I think about that because we had a shop at the older breast center that had all the wigs, and I tell the patients that story. And also, the story that what we had was women survivors that were in the wig shop, and so they would sometimes spend 3 or 4 hours, and I feel so badly when we moved we weren't able to maintain that. But I think it's always kind of a tough thing to think about losing the hair, and sometimes we'll have women in the office and they'll say, I'll take chemo, I'll do anything, but I just don't want to lose my hair. And sometimes you can get around it, but there's other times where the chemo is such that it's going to be a matter of survival. Well, it's been a long time now. What has been your experience with talking to other women? Have you? Well,
Dr. West, women still don't personalize the risk, and that's what concerns me about this 50 year
starting
guideline,
at 50 rather
starting
than 40.
At 50, because had that been in place when I was 38, 40, I would never have personalized the risk, no family history. I wouldn't have gotten a mammogram, and I'd be dead. I mean, it's
I mean,
not
it kind of gives you chills to think of that.
Yeah, it's not a disease of older women.
Yeah.
It's a disease of women.
It's a disease of women, and you make an incredibly important point. When they look at years of life lost, because the women in their 40s or younger, they have a long potential life ahead of them. If everything goes well, there's more years of life lost in the 40s than all the years of life lost from 50 on.
Wow.
So if you're going to concentrate on a group,
yeah,
if anything, your story tells me we should start screening at age 35.
Yeah.
And yet nobody would say to do that. But we know that we see women in their 20s with breast cancer. At that point, it's the breast self-exam, I think, and being aware of it, and then finding a doctor that will pay attention to you, because we're seeing these stories where the patient finds a lump, goes to the doctor, says, oh, you're too young, you're too healthy, it's just fibrocystic, you're a nervous woman, and kind of blow them off. And yet, and again, the diagnosis is delayed. But in your case, they made the first error at age 38, where they should have gotten extra views, at least a 6-month follow-up. Any question, you do a stereotactic core biopsy, and it's quite possible that a lumpectomy was all that was needed, and no chemotherapy. Thank God you beat the odds, but you went from probably a 95+% survivor to, statistically at the time you were diagnosed, maybe 60-70%. Yeah, well, you're in the good half, but it's a flip of the coin almost.
You'd rather be at 95% than 65%.
Well, yeah, I mean,
I know my math.
Think of just the chemotherapy you had to go through, and so looking back on it, what was any lessons learned in terms of how stressful that was for you and your family, and the physical aspects of going through the chemotherapy?
I think, lessons learned would be take a day at a time. Don't be hard on yourself, because it is just about surviving each day through that journey. And then just looking back overall, when you have a life event like that, you tend to reflect on what's important in life, and that's been a blessing, I'd say, in my life since having cancer. But I think what you're promoting is so important, because there are so many women and friends that I've had that have been diagnosed between the ages of 35 and 50. I mean, it's just, I don't understand it.
Yeah. It's just unbelievable, because these are the ladies that you want to put the most energy on. The most, and the incredible thing is now, at the time you were diagnosed, the screening mammogram had about a 25% reduction in breast cancer mortality. Now, with technology has improved so much with screening ultrasound and screening MRI, that we're able to cut breast cancer mortality in half. And yet, at the same time we've made all of this progress, this government committee is telling us to start at 50, do it every other year, and start at 74. Their reasoning behind this is probably undoubtedly cost containment. They're
Right.
worried about spiraling
Right.
healthcare costs, but the data they use to justify this decision is totally flawed. It's a study out of Canada that was just poorly designed. And we talk about that on the website, so that's something
Yeah.
that the viewers can look into if they want an understanding of why they're making this kind of a recommendation. Well, I think this has been a great story, and I think that the key points to remember is 40 is actually stretching it of when to start screening. Here's some, Tanya had no family history. The only reason that she got the mammogram was it was offered at your work. That mammogram could have made it much, much easier on her. But the big lesson is, for the general public, is these guidelines to start at 50, women will die needlessly. They're going to go through more aggressive treatments, like your chemotherapy, and they're going to have a lower rate of survival. We just can't let that happen, and
No.
that's what our 40 not 50 campaign is all about.